How has AI been used during the COVID-19 pandemic?
Yeah, so it's really been a bit of an evolution here. I think in the early days of the pandemic, think about what the major challenges were. There was a shortage of testing, and so it was trying to understand how to prioritize testing. There was also a lot of early challenges around understanding how the virus was spreading, and then a secondary concern about if they got it, would suffer the worst complications. So I think a lot of the initial efforts of researchers and academic institutions, vendors like EarlySign and others, was to focus on those problems. So in terms of prioritizing who to test, it's really a utility question. It really is, you want to test those people who are most likely to have complications. If a person is young and healthy and they get it and they can deal with it, that's not a major issue. But if a person is likely to end up with the severe things like admission to the ICU, intubation, severe sequelae, those are folks you want to get tested so you can treat them appropriately. And there were also a lot of early efforts around quarantine and appropriately quarantine based on family contacts and social contacts. So I think that was a lot of the initial effort. And as testing volume has ramped up and availability of testing has changed, the use cases are now evolving. So EarlySign, for example, we have an algorithm that does look at all individuals and understands who is likely to have the most severe complications. The early use case was around testing. Now it's moving more towards prioritizing resource for contact tracing, which is a best practice in epidemiology that you're seeing a lot of public health entities and medical centers using now and trying to deploy resources around. And now in the future, there'll be antibody testing. And eventually, we keep our fingers crossed that this is sooner rather than later, a vaccine, prioritizing who gets a vaccine. Because in the early days of a vaccine, the quantities will be quite limited. We'll have to be careful, who gets the most benefit that they get it first. Algorithms can really help here. Let me go in a little different direction about a little different use case, or not the individual clinicians and what they see on an everyday basis, but the big picture. And there's been tons in the media about this, trying to understand the geographic spread of the virus and the epidemiology behind that. One of the, I think, pretty clear failings of the public health infrastructure and the IT infrastructure is that we didn't really have very good surveillance to understand this. It's really decades old technology that we're using to track cases, and the reporting around it is pretty archaic. So what we're thinking about, and some of our partners are thinking about, is how do we leverage the ubiquity of electronic medical records, for example, to understand where the hotspots are. And physicians spend a lot of time documenting their encounters with patients, and it would be a simple matter to examine their notes with NLP, understand the frequency of certain terms that are being used, put it on a map, and see how things are spreading. But we've never really done it effectively in this country. And then you can think about that even beyond COVID. I mean, we're thinking about the next COVID. Generals are always fighting the last war, right? So we're doing that right now with COVID. We're preparing for the next version of this. But this kind of surveillance system can also be used for other disease states. It can be used for other infectious disease, it can be used for foodborne outbreaks, it can be used for cancer clusters, and most of the basic data collection infrastructure is there. So I think that's a really exciting future direction.